Welcome back to my YouTube channel. Today, I want to share a real hospital case that began with a symptom many people experience every year, a cough. This cough led to a serious diagnosis. At first, it seemed like something that would eventually go away on its own. But as the days turned into weeks, and the weeks into months, the condition only worsened. A series of warning signs began to emerge that could no longer be ignored. This case is a powerful reminder that our bodies often give us clues long before a serious diagnosis is made. The challenge is knowing when those clues deserve closer attention. And in this patient's case, one particular detail changed everything. What started as a routine clinic visit quickly became a medical mystery that required careful investigation. So stay with me until the end because this story contains important lessons that could help someone recognize when it's time to seek medical advice.
A man in his late 60s arrived at our clinic looking exhausted. As he sat down, I immediately noticed that he appeared thinner than expected for someone of his age. His breathing seemed slightly labored, and he looked concerned. He explained that he had been dealing with a persistent cough for quite some time. At first, he thought it was simply a lingering cold. Then he assumed it might be seasonal allergies. Later, he blamed stress and lack of sleep. But the cough wasn't improving. In fact, it was gradually getting worse. Then came a symptom that finally convinced him to seek medical attention. He had started coughing up small amounts of blood. Naturally, this alarmed him. But that wasn't the only problem. He had also developed discomfort in his chest that occasionally extended toward his shoulder. He felt short of breath during activities that had never caused difficulty before. Perhaps most concerning of all, he had been losing weight without trying. As he described these symptoms, something immediately stood out. Individually, each symptom could have several explanations. But together, they formed a pattern that demanded further investigation. We began with a thorough examination. His vital signs were carefully assessed. We listened to his lungs. We reviewed his medical history.
Was there an underlying inflammatory disease? At this stage, there were still many unanswered questions. We ordered imaging studies and laboratory tests. We discussed lifestyle factors, occupational exposures, and previous health conditions. Several possibilities were considered. Could this be a severe infection? Could it be a chronic lung condition? Was there an underlying inflammatory disease? At this stage, there were still many unanswered questions. We ordered imaging studies and laboratory tests. The goal was not to jump to conclusions, but to gather evidence. As the results began to return, the picture became clearer. However, the findings also raised new concern. The imaging revealed an abnormal area within the lung that required urgent evaluation. Additional testing was arranged to better understand what we were seeing. And eventually, the diagnosis became clear. The patient was found to have lung cancer. Suddenly, all of the pieces fit together. The persistent cough, the episodes of coughing up blood, the chest discomfort, the shortness of breath, the unexplained weight loss. Each symptom had been part of a larger story. This diagnosis was not made from a single symptom alone. It was the combination of clues, careful examination, and appropriate testing that led us to the answer. So what exactly is lung cancer? Lung cancer occurs when abnormal cells within the lungs begin growing uncontrollably. Over time, these cells can form tumors that interfere with the lung's ability to function normally. Because the lungs are responsible for delivering oxygen throughout the body, problems within the lungs can affect many aspects of health. One challenge with lung cancer is that early symptoms may be subtle. Some people initially experience a cough that simply doesn't go away. Others may notice increasing breathlessness, fatigue, chest discomfort, unexplained weight loss, or occasional coughing up blood.
This is one reason why early evaluation is so important. Many factors can increase the risk of developing lung cancer. Smoking remains one of the most significant risk factors because tobacco smoke contains chemicals that can damage lung tissue over time. However, lung cancer can also occur in people who have never smoked. Exposure to secondhand smoke, air pollution, workplace chemicals, asbestos, certain environmental exposures, family history, and increasing age may all contribute to risk. Many people underestimate these risks because they develop gradually over many years. Treatment depends on numerous factors, including the type of lung cancer, its location, and how far it has progressed. Options may include surgery, radiation therapy, targeted treatments, immunotherapy, chemotherapy, or combinations of these approaches. Every treatment plan is individualized and carefully guided by healthcare professionals. In this patient's case, a multidisciplinary medical team worked together to develop the most appropriate treatment strategy. He began treatment promptly and continued with close follow-up appointments. While recovery looked different from person to person, early action provided important opportunities for management and support. There are several lessons we can all learn from this case. Never assume a persistent symptom is harmless simply because it develops gradually. Pay attention to unexplained weight loss. Take ongoing shortness of breath seriously. And always seek professional medical evaluation if you experience coughing up blood. These symptoms do not automatically mean cancer, but they should never be ignored.
Remember, early assessment often provides the best opportunity to identify and address health concerns before they become more advanced. Thank you for joining me for this real hospital case. If you found this story informative, please subscribe to the channel, give this video a like, and share it with someone who values their health. As always, take care of yourselves, listen to your body, and don't hesitate to seek advice from qualified healthcare professionals when something doesn't feel right. I'm Dr. Alinda, and I'll see you in the next video.